This is a summary of my screening of my client, and she had a head-over handlebars bike accident in 2007. She's aware of her body being rather rigid. She doesn't have any dorsiflexion past 0 degrees. I can't get spring mobility. That's a normal property of joints. Now, if I abduct the heel, I can then spring it. You can see that little spring and recoil, that little thrust bounce, return bounce, okay? Hips are in great shape, but the pelvis is incredibly rigid. So I can hardly take up the slack. I'm trying to spring it. I'm trying to glide it to the left. It doesn't move. I'm trying to induce posterior rotation spring test through the entire pelvis with contact on the right iliac shelf. And there's just no mobility there. And that repeats itself when she's prone. Every direction of trying to spring, the pelvis is blocked mobility. The body compensates for this. And it hyperextends at about T3-4 or T4-5, and the sternum and the rib in the front will be blocked right there. I can't spring that. Can you feel that?
Mm-hmm.
What happens when I try and push here?
It's like a rock.
It's like a rock. And then we come above it, then we have spring mobility. And that's repeated in the rib. And on your stomach, it's repeated when I spring the T3-4 or T4-5 region. Ditto on third or fourth rib, okay? The other aspect of this pattern is that reflexively, the upper cervical spine hyperextends. And that's a muscular nervous system response. And it doesn't relax no matter what position you're in. If you lay on your side, lay on your stomach, lay on your back, put a pillow on your head, it doesn't relax it. It's always there. And when I capture the temples and I try to traction your head, there's the tiniest motion and then motion stops. Then I'm not able to do a spring test. If I put you in extension, it basically replicates what's happening and there's no give there. But if I put you in flexion, now I can traction you. I saw your feet move and I can spring it. Okay, so we have a hyperextended atlantoaxial joint. It's not the OA joint because I can get that first little tiny side bending, first little tiny rotation by springing through the mastoid. When I come off the mastoid, there's a very shallow sulcus there, which is indicative of the atlas being hyperextended, okay? And if I try and spring atlas left and right, nope. And if I come and I try to rotate it left and rotate it right, that motion is very restricted. Are you aware of your neck being stiff?
Yes.
Okay, all right. Now, I'm going to extend your head about 5 degrees. I want you to let your teeth separate slightly. Then I want you to relax. All right, so I come behind the mandible and I'm trying to spring it left and right. It's so rigid. I come underneath it. I'm going to spring up towards me. It is so rigid. So it's like you're clenching your jaw all day long. Okay, are you aware of that?
I'm not aware that I don't have the feeling of clenching my jaw.
Wonderful, good. So in terms of treatment, I'm going to start by mobilizing the feet and ankles. Then I'm going to restore mobility of the pelvis and of L5. At that point, I believe that the hyperextension in your upper thoracic and ribs, I believe that that will release. And the hyperextension at your atlas, I believe that will release. The jaw might require a separate treatment, but we'll find out.
Okay.
You never know how the body's going to process. But anyway, I think it's going to be quite simple to restore normal mobility. And I certainly think that you're going to feel a lot better. So I'll stop filming and I'll go to work.
Okay.